Hi, so welcome to Southern Health Podcasts, Conversations with Perinatal Psychology, talking about maternal mental health because your maternal mental health matters for you. My name is Dr. Rachel Davies, and I'm a clinical psychologist with the Maternity Mental Health Service. I also have with me Aileen.
Hi there, I'm Aileen Chick, and I have a history of PTSD and anxiety following a traumatic miscarriage.
Today, Aileen and I are talking about stigma within mental health. So thank you so much for joining us, Aileen. I just wondered if we could start with you just sharing a bit of your experience.
Of course. So I have a 7-year-old boy now. When he was born, I had quite a traumatic labour. It resulted in emergency forceps delivery. He had shoulder dystocia and he was blue and floppy when he came out. He wasn't breathing. I hemorrhaged and I had a lot of physical damage as well to myself. I struggled greatly with my mental health after that. And my boy also spent his first year in and out of hospital, which contributed to a decline in my mental health. It was a long time before we decided to have any more children. And following a few fertility issues, I finally fell pregnant. We discovered at the 12-week scan that baby no longer had a heartbeat, and that baby had died quite a few weeks previously. When the miscarriage began, I hemorrhaged and got blue lighted to hospital. I didn't realise until afterwards, until I got home, how much it had affected me. For the first few weeks, I couldn't even go upstairs. I couldn't go into my bathroom, and I think in total it was about 19 weeks before I could go into my bathroom. I was having flashbacks, I was self-harming, I couldn't function, I couldn't think, I was just in a fog. I couldn't see out of it, and I was really, really struggling. And I was lucky enough to be treated by the Maternity Mental Health Service with Southern Health, and had EMDR for the PTSD and anxiety.
Thank you, Aileen. And I guess, as we said, that our topic today, we were thinking about stigma. And I just wondered whether during that time when you had the PTSD, where you were noticing, those symptoms, did you experience any stigma, do you feel, or any misunderstandings?
Yes, yeah, I did. There was a few moments that will always stick in my mind. So the first one was I was fresh out of hospital, I think about 3 weeks out of hospital, so still recovering physically, let alone even beginning to work through mentally. And my son, as I say, he's 7 now, but at the time he was 4.5. He still wasn't toilet trained because, like I say, he had a few health issues himself. And his nursery he attended were trying to push for him to be toilet trained, obviously before he started school. Now, we had a few months before school was starting. He was a bright lad. We knew it wasn't going to take long once we got started, but they were pushing for it to happen then. Like I say, 3 weeks out of hospital, I was called into a meeting with the manager and a few other members of staff, and got berated for it not having been done yet and saying it needed to happen now. And I tried to explain to the staff that I was physically and mentally incapable of dealing with this right now, that there was nothing in my head. I just couldn't do it. I couldn't see past anything else to be able to function on a daily level, let alone taking on a new task. And I got very much made to feel that that I needed to put my feelings aside, that I wasn't the important one, that how I was feeling, it didn't matter, and that I just needed to get on and get over it and deal with it. And no matter what I said or did, no one could understand that it wasn't something that I could just put aside or get over. that I just couldn't. There was nothing in me that could do it.
This was at a point where you, I think, were so traumatized you couldn't even enter your own bathroom. Is that
I couldn't
right?
even enter my own bathroom. So how was I supposed to toilet train a child? And they just weren't listening. I mean, at that point, I was still in the point where I was self-harming on a regular basis. And yeah, it was completely not understood. And I almost felt that there was an unwillingness to understand as well, to put themselves in my situation, in my shoes, and to listen. They were unable to do that, and it was pushed ahead against my wishes. And I got lumbered with it throughout the week, even though I was obviously mentally unable to cope with it, and obviously couldn't even go in my own bathroom either, which is very tricky to try and toilet train a child.
How did you cope with it?
I left it to family members as best as I could. I was able to go in my downstairs toilet, which was obviously useful because that's how I coped in general throughout that time when I couldn't go in my own bathroom. And we just muddled through as best we could. And luckily, because like I say, he was 4.5, he was absolutely toilet trained within a couple of days, and he was able to do it himself. But like I say, that it could have waited. It could have waited a few more weeks, a month or two. We had the time, and I was ignored.
Yeah. How did that leave you feeling, do you think?
Angry, really quite angry that I was not listened to. And I would have thought people in a professional sense like that would be able to understand better.
Do you have a sense of what could have been different? What might have helped in that way?
Willingness to understand, to listen to other people, and to be kinder to others, to try and put yourself in that person's shoes, in my shoes in this case, and to understand that I wasn't acting that way to be awkward, that I wasn't being combative. It was just that I physically and mentally couldn't deal with it.
Yeah. So that sense of actually being able to step outside, view something from another person's perspective with compassion, with empathy. Were there any other times
Yeah,
for
there
you?
was. So it was when I had my daughter. Like I say, she's coming up 2 now. I had with yourself, Rachel, and with the perinatal midwives, I had a mental health care plan in place. And the plan was for me to stay in hospital after the birth, to help with bonding, to help with processing everything throughout the labour that triggered the PTSD, and just to process everything. And luckily, the labour went as smoothly as any labour can go. And a member of staff who was doing the ward round at the time came in and said, "Right, you're absolutely fine. You can go home this afternoon." And I said, "Well, no, I have a mental health care plan in place. I'm allowed to stay for a couple of days." And the attitude was very much along the lines of, "Well, physically you're absolutely fine. You can't take up a bed just because of how you're feeling. You'll be going home this afternoon." And that was it. I was left in an utter panic, trying to get hold of anyone I could that was part of my mental health care plan. It was on a weekend, so that was quite tricky. Trying to get hold of someone to explain to this member of staff that, yes, physically I may be absolutely fine, but my mental health is as important. It was imperative to my mental health to stay in hospital for a few days.
Have that time to be able to process what's happened, to put you in a good place so that when you're at home caring for your daughter, your own,
Exactly.
you feel like you're in the right place
That's
to
right.
do that. What might have helped? What might have been different?
I think not just for this particular member of staff, but on a much wider national scale, of training and understanding that physical health isn't the only aspect that is important, that mental health has a lot to play, and can affect your physical health as well.
Yeah. So being able to see them on a par, that the kind of good mental healthcare is really important, particularly, after birth, where you've been through a huge experience
Yeah.
in that way, where things have changed.
Yeah.
Yeah.
I think that a whole body wellness approach needs to be taken across the whole board in healthcare.
And do you think, do you have a sense, of this being a common theme about stigma within maternal mental health?
I do, yeah. There's a few mums that I know who various mental health. So one girl, one woman suffers with anxiety and depression, which hormones in pregnancy triggered her symptoms. There's another lady that ends up with quite severe postnatal depression, and several women. All was the common theme of being made to feel that it's just the baby blues, or you're just tired, that you're fine. It's to essentially get on with it, that there's nothing wrong. It's just all your feelings, you're tired, it doesn't matter. Mothers were made to feel that if they do stand up and say, actually, no, I am struggling, my mental health is suffering here, then they're just immediately made to feel that they're incompetent, that they're unable to look after their own children, which in fact for some mums it's quite the opposite. They go into more of a mechanical mode and can parent almost to the point of over-parenting. But it's the mental health, the mental side of bonding, loving their child is what they're struggling with. But the actual physical caring for a child is actually very easy. And it's a huge stigma that a lot of mums are facing, that they're just made to feel that they're incompetent and that they're going to be judged.
Are there other things that you think could be really helpful for reducing the stigma around maternal mental health?
I do think that mental health has come a long way with understanding and awareness, but I do believe that with motherhood, it's still portrayed in the media and in society in general. It's portrayed in a very rose-tinted viewpoint, and as long as you have a happy, healthy baby at the end of it, it's not really taken into account what goes on to get to that point. And for a lot of mothers, where you are portrayed that everything goes absolutely fine and nothing ever goes wrong, there's almost a very woolly, fluffy approach to labour and motherhood. So then when something does go wrong, when you do put your hand up and say, no, I am really struggling, it is viewed as, well, why would you be struggling? You're fine, you've got a baby, what's the problem? And it's very, very hard for a mother to stand up, put their hand up and say, actually, even though I've got my child and they are the best thing that's ever happened to me, that was actually the worst day of my life. And I can say that with my son, with his birth. It was so far removed from what I thought it would be. And also it was highly traumatic for the both of us, that it was probably one of the worst days of my life. And I will admit that. But for a lot of mothers to admit that, it's frowned upon almost. It's not viewed as something you'd ever say. How can you say that when you have this beautiful, healthy, bouncing baby? But it is. And if we could be more open and talk freely, mothers, we've all done the same process. We've all had this massive life-changing experience of birthing a child. Why can't we just talk about it? Why can't we be more open and free and actually able to stand up and say, help me, I am struggling?
So more of that openness. I think that's a really good point. More of those conversations,
Yeah.
feeling like you can say those things without judgment, and that you'll be received with compassion and understanding.
And for expectations to be managed in the first place.
Yeah.
If that open dialogue was there to say that actually some things do go wrong, it's not all going to be perfect, and it's okay if that happens, because we can help you, that would go a long way.
Brilliant. Thank you. Thank you so much for sharing your experiences and your story. And I think you raised some really important points, Aileen. Thank you.
Thank you.
If you have been affected at all by what we've been talking about today, you can access support through your GP, health visitor, midwife, or call 111, who have mental health experts on hand. You can also go to the Southern Health website and click the Help in a Crisis link. Thank you for listening to Conversations with Perinatal Psychology, talking about maternal mental health, because your maternal mental health matters both for you and your children.